Now, for the next thing we'll be looking at in this candidiasis is the treatment. Okay, so the treatment of this candidiasis. Okay, so the treatment we are now looking at using azoles. So there are some types of drugs that it's kind of like a classification of a drug. You call them azoles. Okay, so let's see the different types of these drugs that we can use to treat candidiasis. First of all, you should know that candidiasis is a fungal infection. Okay, so being a fungal infection, you basically use a group of drugs, of course, and this is the fungals, the antifungal drugs. Okay, so for these azoles, we say that they are actually widely, used, and they are very effective. Okay, so they are widely used and they are also very good at their job. So they are used in treating vaginal candidiasis. Okay, so how these azoles work is they inhibit a very important enzyme in the fungi. This enzyme is known as a lanosterol 14-alpha demethylase. This enzyme is very important for producing ergosterol. That's a key component of fungal cell membranes. Okay, so without the ergosterol, the fungal membrane is not strong enough, so to now predispose it to any type of attack, then eventually the organism will die. Right? Examples of those azoles, we have drugs like Clotrimazole. This is Miconazole. This is Clotrimazole. The Miconazole that we're talking about. Then we have Ketoconazole. Okay, we have Butoconazole, we have Teconazole, we have Fluconazole. So each of them, you can look at the form. That's different forms in which you can find the same drugs. You can look at the dosage. You can look at some notes, okay, attached to it. So effectiveness, they relieve the symptoms. They can even eliminate the infection. Okay. Topical agents are preferred for localized infections. Okay, so you just apply it on the skin, so they are acting basically just where the infection is. Then oral fluconazole is convenient and effective, but it may now go and act on some parts of the body that is not needed to act on. Okay.